Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's body chat about headaches. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen into our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good evening, Steve.
Good evening, Ron.
So today we're going to be talking about something that a lot of people suffer from and get partial information on, and sometimes they get things that help with it, sometimes they don't. It's all having to do with headaches. So what would you say is the best simple description of what a headache is?
Well, I'd say it's pain in any region of the head, either on one or both sides of it, and it can be isolated to a specific location, or it can travel across the head from one point or present itself like a vice. And it can appear as a sharp pain, a throbbing sensation, or a dull ache, and it can develop either gradually or suddenly, and it can last from less than an hour to several days.
Okay. And what are the different types of headaches?
Well, headaches are generally classified by cause, and there are two categories, primary and secondary. A primary headache is a headache that is due to the headache condition itself and not due to another cause.
Okay. You've got like something that's muscle tightening or pulling or blood flow decrease or blood flow increase or something like that that's causing the headache, as opposed to something like a hammer hitting your head.
Sure, trauma.
Okay.
Yeah.
Good.
Also, there's secondary headaches, and that's a headache that's caused by another condition. And we'll go into more detail on all the various ones and causes in a minute.
Okay. So it's something external. It's not the headache thing itself, like the muscles in the head that are spasming or your blood flow increasing or decreasing, the stuff we talked about before. So that's a secondary. So what are some of the different types of each headache, and what are some of their causes?
Okay, well, under primary headaches, tension headaches are by far the most common type of headache, accounting for upwards of 90% of all headaches.
Okay.
So pretty much, you'll have like a dull, aching head pain with this, a sensation of tightness or pressure across your forehead or on the sides or the back of your head that's similar to like a tight band. Mm-hmm. You'll often have tenderness on your scalp, neck, and shoulder muscles. Mm-hmm. And this can occur in episodes that can last from 30 minutes to upwards of a week, or they can be chronic, in which they can last for hours and maybe continuous for 15 or more days a month for at least 3 months.
Okay.
Up to 80% of adults in the United States get them from time to time, and about 3% have chronic daily tension headaches. Plus, women are twice as likely as men to get them.
Okay.
There's no consensus on a primary cause, but they can be due to various stresses of life, as well as tightening of the muscles of the back of the neck and scalp, which in of itself can be due to a number of things.
Okay.
And I'll list them.
All right. What are they?
Well, not enough rest is one, because then your muscles fatigue. Mm-hmm. Bad posture, and again, we can refer everybody back to podcast 5 on computer slouch and text neck, because we go into that in great detail there.
Right.
Other causes can be fatigue, hunger, low iron levels. Iron attaches oxygen to red blood cells, and so when you don't get enough oxygen to a tissue, it can cramp up.
Okay.
Spinal misalignments, obviously, which is what us chiropractors take care of. Mm-hmm. Dehydration. You see,
that was the one I was waiting to hear, because I was thinking about that. When you are dehydrated, like you're going to college and you're drinking a lot of beer or something like that, and you get dehydrated. Of course, that's a little different type of headache, but I know that is the type of thing. When you dehydrate, it's like the muscles around your skull all tighten up.
Yeah, exactly. I tell patients that your muscles are made out of water and protein, and you want them to be like a juicy steak, like a filet mignon.
Right.
But when you don't drink enough water, it ends up like beef jerky. And I can actually feel and palpate that.
Yeah. Good point.
Mm-hmm. And then going right along with dehydration is low electrolytes, low minerals.
Mm-hmm.
That can cause muscles to cramp up and tighten up too. So let's move on to cluster headaches.
Okay.
These are rare, and they affect less than 1 in 1,000 and are more common in men than in women.
Okay.
So cluster headaches occur in cyclical patterns called clusters.
Mm-hmm.
And these are very painful types of headaches, but fortunately they aren't life-threatening.
Right.
And they'll commonly wake you up in the middle of the night with intense pain in around one eye and on one side of the head. And it often feels like your eye's being stabbed with a knife.
Wow.
Yeah.
I've never had one of those, and I'm glad to say that I haven't.
Yeah, well, fortunately, they're really rare.
Have you ever had one?
No, I can't say that I have. Thank goodness.
Okay, good.
Yeah. So you typically get these bouts of frequent attacks, cluster periods is what they call them, and they can last from weeks to months. And then you'll tend to have remission periods when they stop. And during remission, no headaches occur for months and sometimes even years, fortunately. Yeah. And they appear to be linked to the circadian rhythm, which is your body's 24-hour clock.
Okay.
They happen so regularly, generally at the same time each day, they've been actually called alarm clock headaches.
Wow.
Yeah.
I never heard of that.
Mm-hmm. And then people with cluster headaches, unlike those with migraines, tend to pace or sit and rock back and forth. Sometimes they have migraine-like symptoms, including sensitivity to light and sound, but they usually only occur on one side, whereas migraines can occur on both.
Okay.
And as far as a medical cause, there's no agreed upon medical cause, but it definitely has something to do with the fifth cranial nerve called the trigeminal nerve. And that's the primary nerve that supplies sensation to the face, including its first branch, which goes around your eye.
Interesting.
Yeah. They're actually more common also in people who smoke or are heavy drinkers. And during a cluster period, you'll be more sensitive to alcohol and nicotine. So even a little bit of alcohol can trigger a cluster headache.
Okay, that's good to know for people that have them.
Yeah. Good news is that drinking won't trigger one during the headache-free periods. Now let's talk about the secondary headaches. We'll cover migraine in a little bit.
Okay. So what are the different secondary headaches and what causes them?
Okay, well, we'll start with sinus headaches. This is due to inflammation and congestion in your sinus cavities, and that's most commonly caused by allergies and infections.
Right.
You can also have spinal headaches, and that's due to low pressure or volume of your cerebral spinal fluid that can result from a leak or from a spinal tap procedure or from spinal anesthesia during surgery.
So that is because there's an increase or a decrease in the pressure that's normally there. Isn't that why that happens?
Mm-hmm. Low pressure.
Yeah, the fluid is normally at a certain pressure, and then there's a leak or whatever, and the pressure is decreased, and that causes the headache.
Right.
Okay. And
exactly. All right, next one's rebound headaches. This is due to overuse of pain medications as well as too much caffeine, whether it's in coffee or energy drinks.
Oh, that's interesting. I didn't know they had a name for that.
Mm-hmm. It's even more likely when you combine caffeine and pain medications. And the reason they're called rebound headaches in the first place is because they occur when you stop taking these chemicals.
Right. Yeah, that's one of the things that people are warned if they've been using a lot of caffeinated drinks to not stop them suddenly, or if they do, that they have to be prepared for headaches.
That's right. Okay, thunderclap headaches. This is the real bad one. Fortunately, they're rare, but they're potentially life-threatening because they usually have to do with bleeding in or around the brain. And that means they can be caused by such things as a broken blood vessel, a blood clot, a stroke, an infection like meningitis or encephalitis, or even severe elevation in a person's blood pressure.
Okay.
And they're called this because they strike suddenly and severely like a clap of thunder, and the pain usually peaks within 1 minute.
Really?
Mm-hmm. They tend to be accompanied by nausea or vomiting. You'll notice the person's mental state will change, and often they'll have fever and even possibly seizures. And this absolutely qualifies as a medical emergency. And so it's vital that you seek immediate medical attention if this occurs.
Okay.
Yeah.
That's good to know. So that's like, it hits real hard and fast and it peaks like within a minute, but it's a very dangerous situation.
That's right.
Okay.
And then finally, ice cream headaches, also known as brain freeze.
Right.
So it's pretty obvious what causes these.
Well, what is it?
Well, when you eat ice cream and it's like stuck against your upper palate for a period of time, it causes that like freezing sensation that goes to your brain because your very thin barrier between your mouth and your brain is just your upper palate.
Right. So it seems like it's a sudden shrinking of the blood vessels or something like that.
Mm-hmm.
All right, good.
Yeah. So there's actually other causes of secondary headaches too.
All right. What are those?
Well, the first one I wanted to mention is hypoglycemia. And this one's pretty easy to spot because not only is it due to low blood sugar from fasting or going too long without eating between meals or eating the wrong foods, but the symptoms also include things like confusion, dizziness, shakiness, hunger, irritability, and weakness.
Right.
So that's pretty easy to spot.
Yeah.
Now, another one that could be pretty serious is concussions or post-concussion syndrome.
All right. Tell me about that.
Yeah, there's usually other symptoms along with this, just like hypoglycemia. And as well as headaches, you'll tend to see dizziness. A person tends to be forgetful, real tired, irritable, trouble concentrating, and they'll have sleep disorders, difficulty sleeping.
Okay.
The important thing about this is that you should absolutely do the following until the symptoms subside. And I learned this when I took my diplomate in sports on the concussion protocols, especially on the sideline. We have a thing called the SCAT, which is a sports concussion assessment tool. Mm-hmm. And this is actually something on that you make sure you go over with the athlete as well as the parent, that they follow this to a T. Mm-hmm. But this applies to everybody really who has a concussion. So I'm going to go through these.
Okay.
So you want to make sure you get plenty of rest when this is occurring, physical and mental. And especially do not use your cell phone for extended period of times or your computer. You don't want all that type of stimulation going on.
Makes sense.
Another thing that's vital to avoid is alcohol, as well as prescription or non-prescription drugs without medical supervision, especially sleeping pills, aspirin, anti-inflammatory medications, or painkillers.
All right. So then that is something you'd have to coordinate with your doctor very closely on.
Mm-hmm. And it's also smart not to drive until, all these symptoms clear up.
Yeah.
Your perceptive abilities aren't very good while that's occurring. All right. Another one, and I brought this up because this is like what everybody thinks of when they have a really bad headache, and that's brain tumors. The chance that an individual develops a brain tumor is very small with a lifetime risk of 1% or less.
Okay.
So just relax. The odds are way against this ever being the cause.
Right. Yeah, but that's true. People do get concerned. It's like, oh, what if I have a brain tumor?
Exactly.
I've heard people say that before, is they have got this headache and it's not going away and they're wondering, do I have a brain tumor? So that's a valid point.
Yeah. I remember one time I had a patient that had an MRI of the brain, and his doctor ordered it. And so he came in and told me what the results were. He was so happy. He goes, "Oh, I'm so relieved. They checked and they couldn't find anything."
Yeah. I know.
I'm like, yeah, I could have told you that.
They did the brain scan and there was nothing there.
Yeah. Okay, a couple other things I want to cover before we go on, and that is food allergies and chemicals like MSG and artificial sweeteners, especially aspartame or NutraSweet, can also cause headaches. Mm-hmm. And finally, there's gallbladder headaches. I see this quite often because I actually look for it. Mm-hmm. And we'll talk about this one a little later too.
Okay.
Yeah.
Good. So then let's talk about migraines. What is a migraine headache?
Well, a migraine headache is much less common than tension headaches, and approximately 12% of the U.S. population has them, with women outnumbering men 3-1.
Really?
Yeah. You'll see in a migraine severe throbbing pain or a pulsing sensation, which can occur on one or both sides of the head. Mm-hmm. And oftentimes the person will have nausea, vomiting, and extreme sensitivity to light and sound.
Right.
And it can cause severe pain for hours to days and can be so severe that the pain is absolutely disabling. I mean, people have to go in a dark room, wear dark sunglasses, crawl up on their side in a bed. It's just miserable.
Mm-hmm.
Now, here's something that's really interesting I found out, and that is 1 or 2 days before a migraine occurs, you can notice subtle changes that warn of an upcoming migraine.
Like what?
Constipation, mood changes, food cravings, neck stiffness, increased thirst in urination, and frequent yawning. Yeah. Now, I know these can mean other things, but if you see this pattern where a bunch of these are occurring, then that could indicate that you have one coming on.
Okay.
Yeah. So I learned about the various classifications of migraine headaches when the new diagnostic codes were released a few years ago.
Okay.
So when I interview a patient that has a history of migraines, I have to ask them 3 questions to properly classify the type of migraine that they have.
Mm-hmm. Okay.
So the first question is, do you experience auras?
Right.
And an aura may occur before or during a migraine.
Mm-hmm.
And most people who have migraines don't have auras.
Okay, but some do. So can you describe what that would be like?
Yeah, well, an aura is like a visual disturbance, such as a flashing or like a shimmering light. They'll tend to see lines that are sort of zigzagging. They might see stars or psychedelic images, or they may just see blind spots in their field of vision.
Okay. So it can be a lot of different things.
Yeah. And they tend to last anywhere from 5 minutes to an hour, and they usually are about 20 minutes long.
Okay.
And so the second question I ask is, are they intractable?
Now, what does that mean?
So this simply is asking if they don't go away no matter what treatment you try.
Okay.
And then finally, does it last more than 72 hours?
The headache?
Yeah.
Okay.
Yeah. So by the way, an optical migraine is not a headache, but instead an eye condition that causes brief attacks of blindness or visual problems like flashing lights in one eye.
Right. I've had those.
Yeah. So it shouldn't be confused with a headache type migraine or a migraine with an aura. I mean, these are basically harmless, and these symptoms normally self-resolve on their own within 20 to 30 minutes.
Yeah, they're freaky, though, I have to tell you, when you're just all of a sudden you see these flashing things that are just kind of in the air suddenly. It's like, what is going on there?
Mm-hmm.
All right, so then is there just one main cause of migraines, or are there multiple different types of causes?
Well, it's a good question, because the medical profession has no agreed upon cause for this type of headache, just like most of the others that we've discussed. But the big reason why women have a 3-to-1 ratio to men as far as migraines is hormonal changes, especially estrogen fluctuations.
Right.
And so they tend to get these headaches before, during their periods, when their estrogen tends to drop. And they also have an increased tendency to develop them during pregnancy or menopause.
Because it's hormonally related.
Yep.
Okay.
So there are some women that get them also when they take oral contraceptives or hormone replacement therapy. And also there's some women that actually do better when they take them. So it's hard to say if that has an influence.
Right. Well, it would depend on that person's individual body.
Exactly. As far as dietary factors, skipping meals or fasting can actually trigger migraines, along with eating aged cheeses, salty foods, and processed foods.
Really?
Yeah, we'll go over that in a little bit because there's certain chemicals in there that do this.
Ah, okay.
Yeah. Food additives, again, NutraSweet aspartame, as well as the preservative MSG, monosodium glutamate, can trigger migraines.
Absolutely.
Drinks like alcohol, especially wine, and highly caffeinated beverages can also trigger them.
Mm-hmm.
Stress at work or at home, obviously. Different sensory stimuli, such as bright lights or sun glare, can induce migraines, as well as loud sounds. And even strong smells like perfume, paint thinner, and secondhand smoke can trigger it in some people.
Okay.
Any changes in one's sleep pattern, including missing sleep or getting too much sleep, can trigger them, as well as, believe it or not, jet lag.
I could believe that, because that really does throw the body off.
Yeah. And then finally, there's some other triggers such as too much physical exertion, changes in weather, including barometric pressure changes, and of course, the use of certain medications, including nitroglycerin.
I could see that.
Mm-hmm.
All right. Well, then, what are the typical medical recommendations and treatments for the different types of headache?
Well, I use the Mayo Clinic website as a reference for headaches and migraine treatment.
Okay. That's a good place to go to check it out.
Yeah, the Mayo Clinic is the gold standard for diagnosing medical conditions. Mm-hmm. But there's an old saying, when it comes to treatment, hold the Mayo.
That's good. All right. I give you an extra point for that.
Okay, good. So as far as over-the-counter medications, we've gone over these in great detail, especially in the previous episode on pain, so I'm just going to list them.
Okay, that's fine.
So one would be, of course, acetaminophen or Tylenol, aspirin, ibuprofen, which also includes Advil and Motrin, naproxen, which includes Aleve and naproxen.
Right.
And the medicine cocktail that combines aspirin, acetaminophen, and caffeine, Excedrin.
Ah, yes.
Now, there's prescription medications for migraines in addition to the over-the-counter meds that medical doctors like to prescribe. First one is a group called triptans. And these are meds that make your blood vessels constrict and block pain pathways in the brain. The most popular one is Imitrex.
Okay.
And unfortunately, there's lots of side effects, including nausea, dizziness, drowsiness, and muscle weakness. Plus, they aren't recommended for people at risk of strokes and heart attacks.
Okay.
Yeah, so most of my patients that have chronic migraines, this is the most popular medication they tend to be prescribed. Hopefully, they're told these things that we just talked about.
Yes, hopefully they are.
All right, and then there's ergots. Those include ergamine and caffeine combination drugs, which are actually less effective than the triptans that we just went over. But the reason they recommend them is they're more effective in people whose pain lasts more than 48 hours. And they're excellent when taken soon after a migraine starts.
That's like drinking coffee, though. I mean, it's got caffeine in it, and so it's trying to pop open the blood vessels.
Yeah. So the problem with them is they can worsen nausea and vomiting, and it can also lead to medication overuse headaches.
That makes sense.
Yeah. Since a lot of people have nausea with migraines, they're often prescribed anti-nausea medications, which are prescribed with other medications. And then, of course, there's opioid or opiate medications. And these are narcotics, especially codeine, that people take. And the big problem with them, again, is they're habit forming, and they're usually only used if other treatments haven't worked.
Okay.
And then sometimes even steroids like prednisone or dexamethasone are recommended when some of these others don't work either.
Okay.
Now, I also learned that there's preventive medicines for migraine and headaches. The Mayo Clinic goes over, and a lot of these are off-label.
Now, describe what off-label means.
Well, what that means is that they're not prescribed for the actual typical thing that they're for that is on the label. So, for example, one of them that is recommended for headaches is antidepressants because they supposedly have been found to prevent or reduce the frequency of headaches and migraines.
Wonderful.
Yeah, I know.
So let's give people something that'll make them suicidal, aggressive, or walk into schools with shotguns because they have a headache.
Right. So another example would be beta blockers and calcium channel blockers, which we normally use to treat high blood pressure. Anti-seizure drugs are used because they can also potentially reduce the frequency of headaches.
Okay.
Botox injections into the muscles of the forehead and neck every 12 weeks to treat migraines in adults has been used recently. But I mean, I don't know about you, but I'm just not real keen about putting botulism toxin into my body.
No, I'm not either.
Nah. And then there's also actually prescription anti-inflammatory drugs that are stronger than the over-the-counter ones that they can prescribe.
Okay.
Yeah.
All right. So now what are some alternative solutions for the different types of headaches that you have seen actually used successfully?
All right. Well, this seems to be an ongoing theme as far as the recommendations, because this is the recommendations for a lot of things that we've gone over in the past.
Right.
Like inflammation and neck pain and stuff like that. So, of course, the first one is chiropractic. And obviously, it not only relieves pressure on pinched nerves, which can potentially cause tension headaches, but the top vertebra in the neck is called the atlas, and it's associated with migraine headaches, according to the most read medical textbook, Gray's Anatomy.
That's right.
In addition, the vertebral artery runs alongside the outside of the neck vertebrae, and it's responsible for 20% of the blood supply to the brain, with the carotid artery making up the other 80%. And so when vertebrae are misaligned in the neck, they can pinch this artery, which can cause reduced blood flow and oxygen to the brain, and that can cause headaches too.
Good point.
Yeah. So the next thing that I recommend is acupuncture and dry needling. They are absolutely phenomenal for headaches. And there's points for general headaches, tension headaches, migraine headaches, sinus headaches, and gallbladder headaches.
That's right.
Yeah. Of course, therapeutic massage is excellent for tension headaches because you're working on the muscles that tend to be tense and up the back of the neck. And then let's get into diet a little bit here because there's good foods and bad foods to cover.
Okay.
Let's cover the good foods first. So believe it or not, a baked russet potato has 3 times the recommended amount of the electrolyte potassium and is 75% water. So it can help with electrolyte and dehydration headaches.
Okay.
And then along the same line, cucumber also has a high water content of 97% water and lots of vitamins and minerals, which makes it also a good choice for all types of headaches.
Okay.
Yeah. Cherries, beetroot, and beetroot juice contain compounds that the body converts to nitric oxide in the body. And that can protect you against tension headaches and migraine headaches.
All right.
Yeah. And then pumpkin seeds, Brazil nuts, almonds, and dark green vegetables are rich in magnesium that can relax the blood vessels in the head that cause throbbing headaches.
Right.
Yeah. So let's get on to the bad foods.
Okay.
Again, a lot of these we've covered in other episodes, including the first one, which is diet drinks and packaged foods that contain aspartame or NutraSweet.
Absolutely.
Wine and some other alcoholic beverages have added sulfites to keep them from spoiling. And sulfates have been linked to migraine headaches. Plus, all forms of alcohol, obviously, when consumed in larger quantities, can lead to dehydration. So the rule should be for every glass of alcohol, you should consume 1 glass of water.
Right.
Compensate.
That's a good rule.
Yep. Now, cured meats such as hot dogs, bacon, and lunch meat contain nitrites and nitrates, and those dilate your blood vessels and contribute to headaches.
Okay.
And in addition, they're high in sodium or salt, which can lead to dehydration too.
Yeah, except for some of the natural or organic brands of lunch meats that don't have them.
That's right.
But you still have to look at the label to make sure.
Now, soy sauce often has MSG, again, monosodium glutamate, which can trigger headaches, and it's usually also high in sodium.
Good point.
Yeah. So if you're going to use soy sauce, I recommend Bragg's liquid aminos because it's non-GMO and it's a much better source. But again, you'd use it in moderation.
That's right.
Now, there are lots of foods that contain MSG or hidden MSG because it has many names, including hydrolyzed vegetable protein, natural flavoring, autolyzed yeast extract, glutamic acid, and monosodium salt, just to name a few. There's I think there's 25 or 30 different names for it.
Okay.
Yeah. So gluten in grains like wheat, barley, and oats definitely can cause headaches too.
Okay.
We'll cover that more in the plant paradox. There was a 2014 study from Tel Aviv University that found that chewing gum on a regular basis can cause headaches because of prolonged intense muscular contraction in the head or the neck.
Wow.
Yeah, I know.
Amazing.
I know. And then finally, here's one that's a little upsetting. Avocados, bananas, and cheese contain tyramine, which is a compound produced by the breakdown of the amino acid called tyrosine. And this substance forces blood vessels to first constrict and then expand, bringing on a nasty headache, including migraines.
Okay.
Now, obviously, it doesn't occur in everybody, but this is something that if you eat these and you notice that, then you should stop eating them.
Oh, okay. So that would probably be somewhat rare, and it could also depend on the amount that a person is eating, too. Okay.
Now, let's cover some supplements.
Okay.
So the 5 most excellent supplements for migraines are magnesium, vitamin B2, which is also called riboflavin, feverfew, CoQ10, and melatonin.
Okay.
So I want to talk a little bit about melatonin because you'd never think that, wow, that's good for headaches. But because it's a natural hormone you usually use as a sleep aid.
Right.
But it's actually similar to an anti-inflammatory drug that is often used for migraines. And in addition, there was another study that compared melatonin to an off-label antidepressant medicine used for migraine prevention. And they compared it also to a placebo. And the results of the study showed that melatonin was better than a placebo in preventing migraines. And not surprisingly, also had fewer side effects than the drug amitriptyline.
Okay.
Yeah. Another supplement that's really good is the herb butterbur. And what it does is it reduces the inflammation of effect of chemicals that trigger headaches, especially migraines. So you want to take at least 75 milligrams twice daily to get the best results. It actually works as a natural beta blocker, which normalizes the blood flow to the brain.
Oh, okay.
Good stuff. And a lot of people are into essential oils, and believe it or not, peppermint and lavender, when you just take a few drops and rub on either side of the forehead, temples, or back of the neck, it's been found to be effective as far as relieving headaches too.
Good.
Yeah. And finally, white willow bark is another good alternative. It actually contains the natural ingredient called salicin. And then that gets actually converted to make the active ingredient in aspirin.
Excellent.
Yeah. And then finally, the last natural thing that I can recommend is exercise. And the reason is that studies have shown that regular aerobic exercise reduces tension and can help prevent migraines.
Good point.
Yeah.
All right, good. So then you'll put together a list of the various different supplements again for us, and we'll put a link in the podcast notes.
All right.
Now, do you have any experiences in helping patients with headaches using some of these alternative methods that you'd like to share?
Oh, definitely.
Okay.
On our previous podcast, I talked about the female police officer who I did acupuncture and chiropractic on. We were able to eliminate that. So that would be one I'd recommend going back and listening to. It's on our pain episode.
Okay.
And there's a couple others that are really cool. When I was in college, I had a roommate and he was a handful. He liked the more traditional manual chiropractic adjustments, whereas I was focusing more on the low force activator technique. And I remember one night before going to bed, he asked me for an adjustment. And I said, well, let me adjust you with the activator. And he says, no, that doesn't work. Just do a manual on me. Go, no, just give me a chance. The next day, I adjusted him. And then when we got home from school later in the day, he said, you know what? That adjustment was the best adjustment I've ever had. I don't know what you did, but not only is my headache better, but I feel amazing. And so he actually became interested in the technique as a result of that. Yeah.
Cool.
So I had another patient who had really bad headaches, and it turns out that we traced them to her use of NutraSweet aspartame. As soon as we found that out and had her stop using it, her headaches went away, and then she slipped and drank like a diet soda or something, and they came back. So that one was really wild because she went to tons and tons of doctors, and none of them could figure it out. It was so simple. It was just that.
Wow.
Yeah.
Very cool.
And then my all-time favorite headache patient was when I was down in Fort Myers. I had a patient who came all the way from Moorhaven, which is where Lake Okeechobee is in the middle of the state. And her daughter drove her down, and she was having that day a really bad migraine, and they were chronic, and they were ruining her life. They were affecting her work, her relationships, and she was at her wit's end. And somehow she found out about me and came down. And what was really interesting about her was when I looked in her eyes, she had blue eyes, but in her right eye, if you look at the eye and it looks like a clock, between 4 o'clock and 8 o'clock, she had this orange rim in her iris. Instead of it being blue, it was orange. Yeah. And at the time, I actually had a book called Iridology by Dr. Bernard Jensen, he was a chiropractor, but he was also known as the American father of iridology. And I never studied it, but I pulled out the book and I looked, and it said that orange tended to mean that there could potentially be a genetic weakness with the liver or gallbladder. And then as far as iridology is a study of the iris, and what they found is the eye is like a map of the body. And so the right eye is like the right side of the body, and left eye is the left side of the body. And so I looked at her eye closely, and around 8 o'clock, she had this really distinct, very bright white ring around it. And in the book, it said that bright white means inflammation, and 8 o'clock is gallbladder. So she had 2 indications of gallbladder. And so then I thought, I'm going to check out her gallbladder because gallbladder can cause headaches and even migraine-like headaches, especially in the temple area, because in acupuncture, the gallbladder meridian actually goes around the ear in the corner of the eye and around the ear in the temple area.
Mm-hmm.
So I actually palpated where her gallbladder was, and it was unbelievably tender. And I started asking her, do you have indigestion, heartburn, things like that? Oh, yeah, but that's not why I'm here.
Mm-hmm.
And so I thought, oh my, we have a gallbladder issue here. So I went ahead and I adjusted her. I did some acupuncture, and I put her on a supplement called AF Beta Food from Standard Process, which is basically organic beets and carrots, amongst other things. It's really good for the gallbladder and liver. And so she drove home with her daughter, and pretty much her headache was still there. And so she told her daughter that I was a quack and I didn't know what I was talking about and how could it be her gallbladder and what a waste of time and money and all this stuff. So she went home and took a nap that day. And when she woke up, her headache never came back. Never came back. So her next appointment was 2 weeks later, and was so funny because this was when our mom was still around, and it was her turn, and she almost tackled me and knocked me over and started crying. She says, I'll never say anything like that again about you. And I'm like, what did you say? So she explained, oh yeah, I called you a quack. I'm so sorry, but my headaches are completely gone. It's a miracle. I can't believe it. And, and she's out there telling everybody in the front room. I mean, it was really cool. So it was nice because that inspired me to learn iridology. And a year later, after I got certified, she actually came back for another type of condition. And I had this really cool camera where I was able to take a close-up picture of her eyes, which were just incredible.
Mm-hmm.
So I look for gallbladder all the time, especially if it's on one side of the head and they're having digestive issues. And those tend to handle pretty quickly and pretty easily.
That's great.
Yeah.
Cool. Mm-hmm. Now, is there anything else you'd like to say about headaches before we end this?
Yes.
Okay.
So I just want to stress that headaches are not normal, even though some people have them frequently and call them normal daily headaches.
Mm-hmm.
Something definitely can be done about them besides taking over-the-counter medications like aspirin, Tylenol, ibuprofen, or naproxen, which, as we covered in our previous episode on pain, they all have very nasty side effects, even though people take them frequently and pop them like candy, thinking they're relatively harmless, when in fact they are harmful.
Okay.
So headaches are symptoms. They're an effect of something that's causing them.
Mm-hmm.
It makes more sense to take the time to discover what's actually causing them, such as a pinched nerve, muscle tension, an allergy, a mineral deficiency, caffeine, pain medications, or any of the other various reasons we went over today, than to not address the cause and just accept it and continue to pop those not so safe medications.
Yeah.
Now, I hope that someday we will look back on this time in history and wonder, how could we have accepted the inadequate mindset of primarily just treating symptoms like headaches with drugs? I mean, to me, as far as a doctor that just does this, it's lazy, since it doesn't really require any thinking or problem solving. And it's also potentially very harmful. Just look at the current opiate crisis in our country that we're now facing.
Absolutely. That is correct.
So what I'm trying to say is I'm very passionate about this subject, and I take pride in the fact that I love to help people uncover why they're having headaches and put together a treatment program that in many cases actually corrects them. I mean, at worst, we transition them from taking a medication to a natural remedy instead, but the goal is always to eliminate them altogether. So yes, it may take more time and might cost a little more too, but in the long run, it's definitely worth it.
Absolutely. Thank you, Steve. That was great.
Mm-hmm.
Next week, we're going to get into a slightly different kind of topic because it's May. The weather's going to start getting hotter. It's going to be summertime soon. So we're going to go into a discussion about sunburns and sunscreen and ultraviolet rays, that type of stuff, because we want people to understand that so that they can properly protect themselves, as well as how much sun does a person really need to get to be healthy. So we're going to cover all that next week on the next Body Chat. And I'll talk to you then.
Good night, everybody.
And good night. Thanks for joining us this week on the Body Chat podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week. And if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.